Welcome and good morning to PACT's digital health program on technology and behavioral health. We are pleased and thankful for the sponsorship of Independence Blue Cross and Capgemini and Invent for this morning's program. Our format this morning is going to be an overview of the topic, followed by lightning talks covering a couple of areas, and then a panel discussion. We are thankful to be joined this morning by several experts in their fields, including Dr. Ginny Kallega from Independence Blue Cross, Dr. Varun Chaudhry from Magellan Health, Dr. Cecilia Livesey from the University of Pennsylvania, and Matt Michelet, the head of clinical operations for NeuroFlow. Just to review the etiquette for the webinar, again, attendees are on mute. Please use the Q&A window to ask any panelist questions. We will be monitoring questions throughout. You also can use the chat window to comment or say hello to fellow attendees or panelists. Before we kick off, let me start and just say it is with heavy heart that we present this program this morning in light of all that's going on across our nation. We thought long and hard about canceling this, and we remain in unison with others against racism and violence and hatred. And we'll be doing our part in communicating our part. In light of the importance of behavioral health for all of us, we thought it was important to continue with this program. And we're going to touch upon in this session some of the key points that are important here, including access, because there's not equality in access to healthcare and especially to behavioral health. So we welcome you, we thank you for your participation. And I now turn it over to Dr. Ginny Kallega, who is the Vice President of Medical Affairs for Independence Blue Cross.
Thank you, Dean, and good morning to everyone. Hopefully you can see my screen at this point. So I want to welcome you to what I think is going to be a very interesting and fascinating discussion. And I wanted to start off with some sobering statistics. So as Dean said, we have issues around mental health. Nearly 1 in 5 US adults experience mental health issues. And those serious mental health issues are concomitant or run in parallel with chronic diseases. And we also know that people with chronic medical conditions such as cancer, heart disease, have concomitant mental health issues such as depression and anxiety. But it's not just an issue around adults, it's also an issue around younger people, teenagers and millennials. And when we look to see issues around millennials, the Blue Cross Blue Shield Association had done a report in April of 2019 around millennial healthcare. And as you can see, the top 10 disease states in millennials include 6 that are behavioral health or mental health issues. And when you look at the far right column, that's the incidence in southeastern Pennsylvania compared to the national statistics from the Blue Cross Blue Shield Association database. So very sobering that 6 of 10 conditions in millennial behavioral health, but the conditions are even more prevalent in southeastern Pennsylvania. And as Dean said, there are issues around access as well as quality in mental health. They're a leading driver of healthcare cost, and the traditional delivery models are not always evidence-based, and the outcomes are not always easily obtainable. And so that's why Independence has partnered with Penn and Dr. Livesey, who I think is going to talk about the program that we had launched together about a year and a half ago, where on the collaborative care model, based off the University of Washington model, there is an embedding of behavioral health social workers in a primary care practice. So as primary care providers are treating patients, they're also, when a patient is willing to discuss their mental health issues, able to deliver that care within the walls of the primary care provider. We've also, as an outgrowth of our millennial health campaign, also partnered with the city on a campaign that just launched last month with respect to the issues that people are suffering, the stress, the anxiety within the COVID pandemic, and that's called Let's Be Mindful Together. This campaign is focused on community partners. It's really about raising awareness of the importance of talking about mental health issues, the importance of seeking care for those mental health, and that your mental health is tied to your physical health and your well-being. And so it's designed to reduce stigma and for the community that we live in to promote free mental health resources, as well as empower the community to help support each other through this. Independence has not only been focused on mental health issues, but we have been a national leader on the opioid crisis and opioid use disorder. So we've partnered with providers to improve prescribing habits, as well as, where appropriate, limiting new starts to a 5-day supply limit, excluding patients with cancer or chronic conditions like sickle cell. We've supported members, trying to educate members as well as engage members through case management to have them engage in treatment options. And then through community collaborations, we've increased access to naloxone by providing that to frontline healthcare workers, as well as having $0 cost sharing with them. And what we've seen in our statistics over the last couple of years is a 45% reduction in opioid users and a 35% decrease in prescribing. And we not only work through our insurance arm, we also work through our foundation. And the Blue Cross, the Independence Blue Cross Foundation has been partnering in the community for many years now, but especially around the opioid crisis. We have a warm handoff program where we've been working with emergency providers in Bucks County, so that if someone is revived from an overdose, how do we get them into care? How do we warm hand them off from their resuscitation to their treatment? And the Someone You Know campaign, if you've not gone to that website, I strongly encourage you to do that, really has focused on reducing stigma of people who are in recovery. Because it really could be someone you know, could be the person sitting beside you, could be someone in your family. So I wanted to just quickly share a number of things that we are doing here in our community.